We actually touched now on the mammography for our female clients. That's also something we order. We talked about the big five for the men and the big five for the women. So breast cancer, obviously, in there you touched on that it's maybe not the our specificity and sensitivity on a mammogram might not be the same as for CT, but it's still something we do.
Yeah, mammograms, even though you need to do 1,300 people, every single woman will benefit from it from the age of 40. So the international recommendations is from the age of 40. And in South Africa, the recommendation is annually, every year from the age of 40. The benefit, getting an annual mammogram reduces mortality by 20 to 30% after the age of 50. And so 20 to 30% of people who have mammograms will survive versus not having it. And it's a bit less between 40 and 50, I think 15 to 20%. And obviously the risk of, it's a low dose exam. The radiation is not the risk. The risk in parentheses is the discomfort part of that. Some people don't like it. You have to put the breast in a X-ray machine. There's some pressure. And then obviously not all biopsies or not all lesions we see is cancer, but we don't have, the mammogram is not extremely specific. So if we see something that might be a cancer, we tend to recommend a biopsy. Our threshold is actually quite low. If there's a risk of more than 10% or 5 to 10% of it being a malignancy, we would recommend biopsy. Lesions that look benign, completely cystic, we would just ignore. Or if it's almost certainly benign, we would maybe follow it up. But if all our biopsies were to be positive, we would miss a lot of cancers. So, and that's probably the biggest drawback, that if you have a mammogram every year for 30 years, there's a good chance that at some stage you might get a biopsy, which will hopefully be negative. But if you do find a cancer, you're going to find it early and, at 1 or 2 centimeters, which means you can get, minor surgery, breast conserving surgery. You might not need chemotherapy, and your risk of having metastases is much lower.